all. This is Dr. Mubin Sayed from Drbeen.com. Welcome to one more show. So today I have two interesting studies or articles, one study, one article. A study is about, one of the studies is about our endothelial cells or that are blood vessels and the health of them in the state of anger. Of course, if I spill the beans, they are not healthy when we are angry. And the second is the article which after years and years in New York Times, there is an article about vaccine side effects and if somebody is listening for these people or not. So these are the two articles. The people that have been or vaccine side effect patients that are in those articles, some of those have been on this channel as well. Sean Berkowitz, Michelle Zimmerman, their interviews are on this channel too. I have requested if Sean is able to join us on Monday, then we'll have a discussion with him as well on this Monday. So with this, let's start our discussion. So this is Drbeen.com. If you want to have more medical lectures, just go to Drbeen.com and see the plans. In the description of this video, there is a link, which is really cheap link to get access. You can use that as well. So that is Drbeen.com. Here is the study that I wanted to share. Translational research of the acute effects of negative emotions on vascular endothelial health. Findings from a randomized control study. If you look at the originally published 1st May 2024, so hot off the press. Let me give you the basic point of this study, and then we can look at some of the excerpts here. In this study, what the researchers did, and if you see the universities, they are from Columbia University, then St. John University. This is the Icahn School of Medicine, Irving, Columbia, and so on. So good universities. There is actually Yale, I think, over here as well. So here, Yale School of Medicine. What the researchers wanted to understand was that if we are in a state of anger, or depression or sadness or anxiety, does that cause any change on our blood vessels? And could that be a foundation for cardiac events or cardiac issues? So for this, what they did was they had 280 persons. They asked them to come to their lab, spend some time there. The persons would arrive there 8:30 in the morning. They will relax for a few minutes. Then they would take their blood pressure. They would take their blood samples as well. Plus, they would use a device called PAT. So let me show you very quickly this device. So here is a device that shows peripheral arterial tone, or it can detect how the blood vessels are doing, if they are dilating or opening up or not opening up. And based on that, it can give you the readings for the blood vessels. So this is a good device to understand the vascular health. So they use this PAT device as well to understand health. They also took other labs for cholesterol, etc. Now what they did was they asked the persons, the individuals, to sit down for 8 minutes and think about, so one group, they asked them to think about something that makes them angry. Another group, they asked them to think about something that makes them depressed. Another group, they asked them to think group who was control, and they had asked them to just count numbers. With this, what they were now measuring were 3 things. They wanted to understand if the blood vessels were opening and closing correctly, vasodilatation was occurring or not. That is one. Second, they wanted to understand if the endothelial cell or the inner vascular wall cells, if these were getting damaged. So they were looking for the particles coming out of the damaged endothelial cells in the blood. And number 3, they were seeing if the repair cells from the bone marrow were coming in to help repair the damaged blood vessels. So these were the 3 things that they were measuring. The point of view of measuring this was that there has been a lot of studies that say that when somebody is under stress, they can be prone for heart attacks, or there is a possibility of people under stress to have long-term cardiac outcomes. But they wanted to see what exactly is going on. So here is what they found. They found that people who were putting themselves in the state of anger by recalling some angry moments, their blood vessels compared to controls did not have correct vasodilatation. So blood vessels became vasoconstricted. That means these blood vessels would, number one, end up causing blood pressure because they are not dilated. And number two, when the blood vessel is stiff and the blood is moving through it and gushing through it, it can actually cause injury to the blood vessel itself. So this was a short-term study. So they say that we cannot extrapolate what will happen in the long term, but it is understandable that if somebody is in a state of anger again and again, then their blood vessels can be repeatedly in this traumatic state and be damaged. Or if somebody has other reasons for the blood vascular damage, in addition to being angry, then that would also cause the blood vascular damage. For example, somebody is, let's say, uncontrolled diabetic, or somebody is hypertensive, or somebody is in a chronic inflammatory state. All of those can actually be the contributory factors that can cause damage to the cardiovascular system. And top that off with somebody who is in a state of anger, then the vascular damage can actually increase, which may lead to cardiovascular events. Now, what they were able to prove was the vasodilatation was affected by anger for 8 minutes. And that effect went from 3 minutes to 40 minutes. And after that 40 minutes, that effect went away. So it was not a chronic effect. It was not a constant effect. It stayed there for 40 minutes and then went away. In case of depression or sadness or anxiety, nothing like that happened. No vasodilatation or no vasoactivity was compromised. So maybe these negative emotions of depression and anxiety may have other kind of effects, but in this study, the effect on the vascular system was not proven. They also said that that means we should not lump all of these negative emotions, that is anger, depression, and anxiety, together and try to manage that together, because anger can cause vascular health problems while anxiety and depression does not. So this is the basic study that they did. One request that I'll make, and I've done this discussion before, that video that I did is called forest bathing. I actually have that study right here as well. One request I'll make is that forest bathing, or being near plants or trees, especially the trees that have those essential oils, the tree oils that you can smell, that can actually release tension and reduce stress hormones. So I'm going to switch back for a second to this study. In this study, the researcher said, we do not know exactly what is the mechanism of this vascular health issue with anger. It may be sympathetic tone problem. It may be the reduction in production of nitric oxide, which is produced in the endothelial cell and causes the smooth muscles of the blood vessels to relax. It may be the production of endothelin 1 by the endothelial cells, which causes vasoconstriction. It may be more things. They do not know the exact mechanism. They just know the outcome. So this may be something to do with the stress hormones, cortisol, steroids, adrenaline, noradrenaline. So if you go back here to this study, this is the effects of forest bathing, trips on human immune function. I believe this is a Japanese study where they sent a number of people to forest compared to another number to city and asked them to just have fun and relax and enjoy. And they found out that the people who went to forest, people who were near plants and trees, the phyton sites of the trees. So here, if you see phyton sites or wood essential oils, these essential oils are antimicrobial. These are also stress releasing oils. What they do is they increase the natural killer cells in your body, plus they reduce the salivary cortisol and general adrenaline, noradrenaline, or the stress hormones, which then improve your immune function and improve your health in general. So one possibility in a natural way of countering this anger's outcome is to be near plants or have essential oils, plant oils with you. So this is one study. The takeaway of this study is, please see if you can figure out ways to be not angry or less angry. Such a counterproductive statement though, because asking someone who is angry to say you should not be angry would actually make them even more angry onto themselves and onto the others. So if I am angry and you say, well, don't be angry, I'll try to calm down. And if I cannot, I'll become even more angry that I cannot calm down. Or somebody else is asking me to calm down. Am I going nuts? So I understand that sensitivity of this, but this is an important study to understand that anger and even thinking about anger can cause vascular health problems. It can cause hypertensive state because the vessels are not dilating anymore for 40 minutes at least. And in the presence of other comorbidities or in the presence of repeated such sequences, this could become a foundation for cardiovascular events. So very important study, and I hope that you will give this a look. I have gone through all of it, but I don't want to take more of your time to explain this. This is the summary of it. Okay, now I'm going to move forward from here. So this is this study. This is endothelin 1. Now this one, second part. New York Times, for the first time ever, is writing, thousands believe COVID vaccine harmed them. Is there somebody listening? So I have this archive over here. Thousands believe COVID vaccine harmed them. Is anyone listening? All vaccines have at least occasional side effects, but people who say they were injured by COVID vaccine believe their cases have been ignored. So this is a very, very interesting and important article by Apurva Mandavili. And I'm going to just read a few excerpts from it. The link is in the description. Please go to New York Times and read it. It has Michelle Zimmerman, who I have interviewed a few times on Drbeen. It has the story of Sean Berkowitz as well, who I have interviewed 3 times on Drbeen and will be with us on this Monday as well. Interesting for me is the following. It is almost impossible for the mainstream medicine to recognize or acknowledge that there can be vaccine side effects. There is always this statement of there is a very rare possibility of side effects. But when it comes to actually facing someone who may have them, there is always a dismissive attitude. And what is interesting for me is that if you broadly put people in 2 groups, which unfortunately we are at this time in these 2 groups, people who are anti-vaccine and people who are pro-vaccine, the people who got vaccine and developed side effects are actually those who were in the vaccine group. They went ahead and did what was asked of them, and they got injured. And I find it strange that those folks who are against vaccines, they celebrate it by saying that, see what happens to you, see what happened to you, this is what you get if you do this. And I think that is shameful. Similarly, the people who are purely pro-vaccine, who believe vaccines cannot do any harm, vaccines do benefits, that is fine, they cannot do any harm, they actually also look at these folks and say, you are just making it up. So for me, it is embarrassing to see these folks, the folks with the side effects, almost become nobodies in modern decent societies. So let's look at it. Within minutes of getting the Johnson & Johnson COVID-19 vaccine, Michelle Zimmerman felt pain racing from her left arm up to her ear and down to her fingertips. Within days, she was unbearably sensitive to light and struggled to remember simple facts. So she was 37 with PhD in neuroscience, and until then could ride her bicycle 20 miles, teach a dance class, and give lectures on artificial intelligence all on the same day. Now, more than 3 years later, she lives with her parents, eventually diagnosed with brain damage. She cannot work, drive, or even stand for long periods of time. Similarly, if you see here, Dr. Zimmerman's account is among the more harrowing, but thousands of Americans believe they suffered serious side effects following COVID vaccination. As of April, just over 13,000 vaccine injury compensation claims have been filed with the federal government, but to little avail. Only 19% have been reviewed, only 47 of those were deemed eligible for compensation, and only 12 have been paid out an average of $3,600. So this is Michelle. Hundreds of millions of people in the United States have safely received COVID vaccines under the most intense safety monitoring in US history. Jeff Nesbitt, a spokesman for the Department of Health and Human Services, said in an emailed statement. But in the recent interview, Dr. Janet Woodcock, do you remember Dr. Janet Woodcock? She was working with the COVID. A longtime leader of the Food and Drug Administration who retired in February said she believed that some recipients had experienced uncommon but serious and life-changing reactions beyond those described by federal agencies. I feel bad for those people, said Dr. Woodcock, who became the FDA's acting commissioner in January 2021 as the vaccines were rolling out. I believe their suffering should be acknowledged and that they have real problems and they should be taken seriously. And as I read some more of the excerpts, you would actually see within this article, Apurva did a great job of actually presenting the cases of these individuals and then presenting the counter statements from the others. And you would see somewhere a little down that the people in the mainstream would be saying that, well, there are so many anti-vaccine people with their campaigns and narratives that it is very difficult to actually understand who actually has the problem. I think it is a cop-out. I think it is an excuse. And if it is somehow a punishment of people who are using anti-vaccine or who are campaigning against vaccines, and to punish them or to take our anger out on them is by dismissing those who may be injured, I think that is quite an immoral position to take. I'm disappointed in myself, she added. I did a lot of things I feel very good about, but this is one of the few things I feel I just didn't bring it home. So I'm not real. Patients who believe they experience serious side effects say they have received little support or acknowledgement. Sean Berkowitz, 54, a nurse practitioner in New York City who has worked on clinical trials for HIV and COVID, said that ever since his first COVID shot, merely standing up sent his heart racing. I can't get the government to help me, Mr. Berkowitz said of his fruitless pleas to federal agencies and elected representatives. I am told I am not real. I'm told I am rare. I'm told I am a coincidence. And I was talking with Sean today over the phone, and I was saying that individuals like you do not belong anywhere in the society anymore in this context of the medical management. On one side, there are folks who are anti-vaccine, and they are kind of looking at these folks and say, look, you went for it, and that's why you got it. And then there are folks on the pro-vaccine groups, unfortunately, we have these groups who are just simply saying, you are making it all up. And you would see those kind of excerpts in this article as well. Rene France, 49, a physical therapist in Seattle, developed Bell's palsy. I thought for sure someone would reach out. So she said that she put her message in VAERS twice, but nobody reached out. Nobody did the research. Even leading experts in vaccine science have run up against disbelief and ambivalence. Dr. Gregory Poland, 68, editor-in-chief of the journal Vaccine, said that a loud whooshing sound in his ears had accompanied every moment since his first shot, but that his entreaties to colleagues at the Center for Disease Control and Prevention to explore the phenomena tinnitus had led nowhere. I'll give you another example on this one. There is a study by NIND, National Institute of Neurological Disorders, of 12 people who they thought are vaccine injured. These majority of the people in that study are still suffering. However, they have concluded their study by saying we gave them steroids and they all recovered. Dr. Buddy Creech, 50, who led several COVID vaccine trials at Vanderbilt University, said his tinnitus and racing heart lasted about a week after each shot. It's very similar to what I experienced during acute COVID back in March of 2020. Research may ultimately find the most reported side effects are unrelated to the vaccine, he acknowledged. Many can be because of COVID. Regardless, when our patients experience a side effect that may or may not be related to the vaccine, we owe it to them to investigate that as completely as we can. Federal health officials say they do not believe that the COVID vaccine caused the illness described by patients like Mr. Berkowitz or Dr. Zimmerman and Ms. France. The vaccine may cause transient reactions such as swelling, fatigue, fever, according to the CDC, but the agency has documented only 4 serious but rare side effects. So the agency actually doesn't believe that this could be happening. Then listening for signals. This is also a very interesting part of the article where Purva is talking about VAERS. And the VAERS is a very interesting situation. On one end, VAERS can be easily criticized to say, well, anybody can go put whatever they want in there. So the data isn't really as reliable. It is overreported. It is underreported. It is not correctly reported, etc. On the other hand, the same database is also used to prove that, hey, there is nothing that we can see here. And I always believed, I think majority of us know the Zoe app. Zoe app, a few people were able to put together an app quickly enough to track people's symptoms and their illnesses and their ongoing changes. We could not, at a government level, we send billions of dollars to other countries all the time. We could not put our own little app together, and we are still going with VAERS. And then whenever we like it, we give VAERS very high numbers for that is the database. And whenever we like it, we say, well, that is not a reliable database. I can't imagine these things happened. So those national surveillance efforts include the Vaccine Adverse Events Reporting System. It is the largest database, but also the least reliable. Federal researchers also comb through databases that combine electronic health records and insurance claims on tens of millions of Americans. The scientists monitor the data for 23 conditions that may occur following COVID vaccination. Officials remain alert to others that may pop up, Dr. Daskalakis said. A red flag. So now this is interesting that Apurva then talks about other countries and how they are finding the red flag. So for example, in Hong Kong, the government analyzed centralized medical records of patients after vaccination and paid people to come forward with problems. The strategy identified a lot of mild cases that other countries would not otherwise pick up, said Ian Wong, a researcher at the University of Hong Kong who led the nation's vaccine safety reports efforts. That included the finding that in rare instances, about 7 per million doses, the Pfizer BioNTech vaccine triggered a bout of shingles serious enough to require hospitalization. The European Medicine Agency has linked the Pfizer and Moderna vaccines to facial paralysis, tingling sensations, and numbness. The EMA also counts tinnitus as a side effect of the Johnson & Johnson vaccine, although the American health agencies do not. FDA is monitoring reports of tinnitus, but at this time, the available evidence does not suggest a causal association with the COVID-19 vaccine, the agency said in a statement. I cannot even believe that this is true. Despite surveillance efforts, US officials were not the first to identify a significant COVID vaccine side effect, myocarditis. I mean, this is a great case report of the agencies that are raising their hand and saying, we are combing through the data, we are doing this, we are doing that, we are on top of it. And despite all of their claims and apparent efforts, myocarditis in young people receiving mRNA vaccines was not identified and caught by the US. It was Israeli authorities who first raised the alarm in April 2021. Officials in the United States said at the time that they had not seen a link. So then here is that discussion of misinformation. And it is correct. There are individuals who have made so much of a mess in this narrative that the people who actually have the problems are now drowning in the sea of that bad narrative. So the sheer nature of misinformation, the scale of misinformation is staggering. And anything will be twisted to make it seem like it's not just a devastating side effect, but proof of massive cover-up, said Dr. Joshua Schaffstein, a vice dean at Johns Hopkins. The officials each responded with that very tired mantra, but the virus is worse. So this is another thing that I was discussing yesterday when I did the talk about the AstraZeneca. When I was preparing for that talk, I was also preparing for one more topic, and that was cardiac failures in individuals after years after the vaccination, and is there any truth in there? Is there any data in there? And it was very interesting for me that majority of the data that I looked at, or the articles that I looked at, they would start with, well, there is myocarditis with the vaccine, and they would very soon go into, but hey, the virus causes more damage. So the question that I have for such folks is, imagine, let's give you this, that let's say virus causes out of 1,000 people, 100 people's cardiac problems. I'm just making up numbers just to make a point here. And let's say the vaccine protects them from those 100, and vaccine itself causes 3 people to have the cardiac issues. Huge number difference, right? Will we then be willing as a society to say that these 3 people who got the damage, let's just leave them alone? They are part of the sacrifices community made to protect itself, and let's not care for them? Is that the actual message? Whenever somebody says, I may have a side effect, and we look at them and say, well, the COVID would have been worst. Is that the message, that we should ignore you now? So here, the officials each responded with that very tired mantra, but the virus is worse. Dr. Murphy recalled, yes, the virus is worse, but that doesn't obviate doing research to make sure that there may be other options. Or for me, virus may be worst. Vaccine is safe and effective. Let's do that. Let's say that. But those who are injured, what about them? Do we dismiss them? Do we ignore them? Do we let them suffer? Is that what we will do? And so if that is what we'll do, then sure, this is a good line. Hey, if you had been infected, you had been in the worst situation. But I think we are capable. We have resources. We have intelligence. We have, at least in majority of the people, the desire to fix this as well. And I always say this, I'm going to repeat it. If this is a rare situation, then it is even easier to take care of these patients because they are rare, they are lesser in number. We can send billions of dollars to other countries. We can't put 10, 20, 30 million dollars to take care of these patients. They are rare, they are fewer in number. A deeper understanding of possible side effects and who is at risk for them could have implications for the design of future vaccines. So then here, instead, claims regarding COVID vaccines go to the US has a different system for COVID vaccine claims. So if I just read a little bit here, the federal government has long run the National Vaccine Injury Compensation Program. And I'm going to leave that there and come back here to this paragraph. Instead, claims regarding COVID vaccine go to the Countermeasure Injury Compensation Program intended for the public health emergencies. This program has narrow criteria to pay out and set a limit of 50,000 with stringent standard. Do you know the standards? Check this out. You have to prove, the patient has to prove a compelling case. Compelling, reliable, valid medical and scientific evidence has to be provided within 1 year of injury to then maybe get $50,000. The program had only 4 staff members at the beginning of the pandemic and now has 35 people evaluating claims. Still, it has reviewed only a fraction of 13,000 claims filed and has paid out only 8 dozen. Dr. Zimmerman, the neuroscientist, submitted her application in October 2021 and provided dozens of supporting medical documents. She received a claim number only in January 2023. In adjudicating her claim for workers' compensation, Washington state officials accepted that COVID vaccination caused her injury, but she has yet to get a decision from the federal program. One of her therapists recently told her she might never be able to live independently again. That felt like a devastating blow, Dr. Zimmerman said, but I'm trying not to lose hope. There will someday be a treatment and a way to cover it. So this is the discussion, 2 studies. Please make sure that you look at the very first one and see what are the ways you can handle, if at all, you can become angry on things. What are the ways to relax? That should be an important tool in our tool sets going forward for cardiovascular health. And number 2, look at this article as well. This is, I think, after years and years, one article which is kind of pointing out that there is a number of people who are suffering and need help. With this, thank you very much. Please like, subscribe, and share. And if you would like to have access to more lectures, either join me on Substack or Patreon. All links are in the description, or join me on drbeen.com. Thank you very much, and I'll see you next week. We'll have Sean Berkowitz with us on Monday. Bye for now.